We all know what discrimination is, right?
Yeah, it's when people are unfairly judged based on assumptions that are being made about them, even when they don't know each other and their opinions aren't based on any facts. But assumptions and opinions aren't discrimination until they're acted on. Once someone treats you poorly according to their opinion of you, that's discrimination.
Discrimination isn't supposed to happen in BC. That's why we have a set of laws called the BC Human Rights Code. The Human Rights Code is supposed to protect you from discrimination based on a set of characteristics in certain situations. In our daily lives, during times like looking for a job or a place to live, accessing services like campgrounds or restaurants, we should not experience discrimination based on these characteristics.
But let's say you have a limited education level. Maybe you didn't finish elementary or high school, or that you have a very low income level because you work a certain kind of job, or maybe you're unemployed and you make your money in other ways. You might be unhoused or precariously housed, including couch surfing. You're not protected by the Human Rights Code.
Social condition discrimination has a huge impact on the health and well-being of all of us, even people not living in poverty. And let's be clear, people living in poverty are not the reason why our health system is strained. Discrimination is.
And there's one small change that can have a huge impact.
Adding social condition to the BC Human Rights Code as a protected characteristic from discrimination. Okay, so we just used a lot of different terms, and you may not know what they all mean. Let's break it down.
Some provinces and territories already protect people from social condition discrimination by using the Canadian legal system. Each province and territory has their own way of defining social condition, and the way that we mean it, when we talk about it, is inclusion in a socially identifiable group that suffers from social or economic disadvantage on the basis of poverty, sources of income, occupation, housing status, level of education, or any other similar circumstance.
And in the fields of health and social research, socioeconomic status is used to describe social condition and class.
Another term you might not know is health inequity, which is the systemic and unjust differences in health outcomes between different communities. By the way, this is an example of systemic social condition discrimination.
What about stigma?
Stigma is an ancient Greek word meaning to stick. Ancient Greeks would physically mark or brand people to assign them with a label. In this day and age, we're not physically marking people. Instead, we're giving them the invisible mark of a derogatory label. Having a stigmatizing label implies to the people around you that you can't be trusted to make morally agreeable choices according to your society's rules and values.
Stigmatizing labels always result in people being outcasted and marginalized, resulting in poor health, social, and economic outcomes. If you experience stigma, you are more likely to have a poor social condition, and vice versa. Stigma is deadly because of its detrimental impacts on people's physical and mental health, not to mention the vigilante violence that stigma enables. Now that we have the definitions out of the way, let's get back to the problem and the solution.
Factors like how you earn your money, your education level, your housing status, and other similar circumstances impact your social, health, and economic outcomes. Capitalist societies like ours base human value on how productive we are for the economy. And if we're not earning, or if we're earning our money in ways that contradict our society's values, then our value as a person is diminished. This treatment doesn't only affect people in their day-to-day interactions with other people. It's a systemic problem, meaning that it's ingrained in every structure and institution of our society. Obvious examples of institutions in our society that judge people based on their assumed socioeconomic status are the intertwined systems of policing, prisons, and the courts.
Everyone knows that living in poverty is associated with a variety of negative health outcomes, including an increased risk of developing and dying from infectious and chronic illnesses, on top of negative, stigmatizing, and traumatic experiences from service providers when trying to access healthcare.
These experiences can be so bad for people that they won't return to their doctors or the hospital when they're sick for fear of being further traumatized.
This, of course, impacts our overall public health and healthcare systems, but it also highlights the massive gap between the haves and the have-nots.
We believe that access to affordable, quality, and culturally acceptable healthcare is a human right.
And because of social condition discrimination, people who experience poverty are at an extreme disadvantage in accessing and asserting that right.
To close the health inequity gap between people living with poor social conditions and those who aren't, systemic social condition discrimination must be eradicated, and human rights protections are one avenue to that change. While we continue our work advocating for changes to the law, there are other ways that public health workers, policymakers, and members of the public can stop this kind of discrimination from happening.
You can help. Simply scan this QR code or click the link in the description to contact your MLA. Urge them to take the next step in advancing BC's Human Rights Code.
Before we go, we want to express our gratitude to the people who have been advocating for these exact changes for decades. Your teachings continue to power the positive shift in our society towards humility and acceptance for those whose circumstances are different from our own.